I always say support staff, and I'm glad that you mentioned support staff too, because they're often forgotten about, and people just talk about teachers. Just before I carry on, Tom Hunt wants to ask a question about vaccinations.
Good morning, Secretary of State. I'm aware that there's a letter sent to you recently by, I think it was HMC, and I have a school in my constituency who's working with other schools who feels as though it has the facilities and also the trained staff to be able to vaccinate all of the local teaching staff in the area. So it would simply be a matter of getting them the vaccine, but they'd be able to take care of everything else without detracting away from the other wider vaccination strategies. So I just wondered what your thoughts were. If you have, I think that letter was actually sent pretty recently, so I don't know if you, but firstly, what your thoughts are on that, because it does seem like a lot of the schools really are prepared to roll their sleeves up and be part of, getting teachers vaccinated.
Concisely, if you can.
Of course. Tom, as I'm sure, I haven't actually seen the letter, but I will make sure it's dug out immediately. Obviously, the JCVI have set out those who are most at risk of death and most at risk of harm, and so they have to be the top priority. I want to see my priority is to see teachers, support staff be in the place to be able to get the vaccine at the very earliest moment. And I agree with you. I think there is a real appetite and there is a real ability, as we've already seen with testing, that schools can play a major role in the rollout, not just of testing, but in terms of vaccination, making sure we get to that position where we're protecting that really, really critical workforce that's so vital for all of us, but most importantly, so vital for our children.
Yeah. So it's good to confirm that you are fighting that teachers and support staff get moved up the priority list for vaccinations.
Mr. Chairman, absolutely tooth and nail. It's the thing that I have conversations with every single day. But Tom, on your point, I'd be very happy to sort of meet up with yourself just to have a bit of a discussion in detail on the back of that letter.
Thank you. I have a couple more questions before I pass to my colleagues. I just want to talk about disengagement from learning and vulnerable pupils. We know that before the most recent lockdown, overall truancy rates almost doubled in autumn 2020. Average absent rates in the recent autumn term was 4.4%, which rose to 8.5% in late November. And that's after COVID-related absences were factored in. Wraparound access to social services diminished during the lockdown. Children's social care teams received 18% fewer referrals than in the same period over the prior 3 years. My concern is that the lockdown could further exacerbate a rise in disengagement seen during the autumn term, and that fewer children will be able to access local support services. COVID aside, what is the department's plan to re-engage learners who are falling off the radar, and how will you support multi-agency working at a local level?
So I think we'd all say that COVID has created enormous challenges for every sector, certainly, and not least education. But there are sometimes good things that can start to emerge from this. One of the things that has really started to emerge is a much closer working between schools, social services and local authorities, but also the police forces in local areas, and how they're actually engaging together in terms of actually working together to have a constant dialogue, constant communication, constant support with children. The initial data that we've already seen starting to come in from just the first day of this week is we've seen a much higher level of children with social workers in school than we saw last time. We saw a variability of between 4 and 28% of children who had a social worker in schools in the last term, in the first lockdown where schools were closed. This time, and it's still too low. That's at 40%. We have a clear strategy in terms of working with local authorities, with our REACT teams, supplementing and supporting local authorities with Ofsted in terms of helping them if they need extra support in order to be able to reach out to most vulnerable children. But there is a bigger issue in terms of long-term engagement. And you've highlighted it as to the fact that there were more of those children who weren't attending school when schools were fully up and running with all year groups invited. This is where it becomes really important in terms of getting the discipline and behaviour structures right within schools and making sure that all schools have really strong policies in terms of truancy, and making sure that there's an exceptionally low tolerance level of truancy within schools, and how we best support schools in order to be able to implement that. So those who are most vulnerable recognise the school is there, it's the safest place for them, and it's the best place for them.
Just we know that in the last lockdown, just 6% of vulnerable children attended school. I'm talking about the main lockdown starting last March. And last week, am I correct in saying that the department suspended the attendance data collection they've run since last April? If that is so, it means it won't be possible to assess whether schools are being inundated with pupils, as many that are claiming. Will the publication of this data resume so that we can find out what is exactly happening to vulnerable children, whether or not they're attending school?
Of course, Mr. Chairman, and we obviously, in terms of the changed circumstances, we had to change the way that we were collecting data as it wouldn't be reflective of the circumstances that schools found themselves in. And just this morning, we made an ad hoc release of data, which I think is to give people a clear sense of where things were on the first full sort of the first full day of collecting that data. It was, as I just referred to, 40% of children with EHCP plans were in attendance, 46% in primaries, 25% in secondaries, 29% in special schools, and 36% in alternative provision. 40% of children with social workers were in attendance. So as you can see, a much higher rate than last time, but recognising that there is still much more work to do. And the overall attendance rate, sorry, Mr. Chairman, the overall attendance rate was 14% of pupils were in school.
Thank you. I'm very happy if you call me by my first name, by the way. Just finally, I just want to ask you about alternative provision. Can you confirm that alternative provision is obliged to stay open for all of their pupils during lockdown? And if there is no obligation to do so, are they allowed to stay open to all pupils, even if some are not on the vulnerable critical workers list? And just finally, the government softened the requirement in the last lockdown for councils to support pupils of the HCP plans. And can you confirm whether you're doing the same this time?
So in terms of, it's really important. As I said in my statement yesterday, we do, as I said in my statement last week, we do ask, parents are in a position to be able to keep their children at home. We do ask them to keep their children at home, but if they're in a position where that isn't possible, if they're a critical worker or they're a vulnerable child, we do want to see those sort of places made available to them. And we hadn't got any plans in terms of changing the
Is it not going to soften the requirement on the EHCP as happened last time?
There's no intention of doing that.
And AP, are they going to be obliged to stay open for all their pupils or not?
Yeah, and we are asking AP to stay open, and we've seen already in the first cut of data that we've had is that, sorry, if I just sort of look through the, I'll just try and find the exact data on the AP opening. Sorry, I do apologise.
Just to say the AP, you can send us the data, but just to...
24%, as I say, 24% are attending an alternative provision. And what we're asking is alternative provision is to work with parents and children. Is it open
to all of their pupils or just critical workers and vulnerable?
Well, it's open to all those with an EHCP plan, which obviously is a very high proportion, but we're asking them to work with parents where there is a very specific need in order for them to be able to do that, and to work with parents to work with the need of a child if that needs to be made available to them. And in many
cases, I think that Susan wants to say something.
Of course, yes.
Yes, Secretary of State, sorry, I hope it's helpful. I think the first thing to understand is the definition of vulnerable children is one where we give some discretion to the school, because we think they have the best understanding of which children are most vulnerable. And that means that for AP, that open for all children with ECHPs and all those that they deem vulnerable. And for many AP settings, that will be all the children in the school. But we've also offered them some flexibility to work with parents, because again, they understand their children and their parents well, and they understand what's going to work for them. And so many settings talk to us about the value of being able to design patterns with parents, actually as AP settings do quite a lot of the time in normal times, to try and manage patterns of attendance that are going to work and keep the largest possible number of those children engaged. So yes, they can open for all their children, but they can also design sensible patterns of attendance with pupils and parents that are going to make sense for them and for their cohort.
Thank you. I'm going to bring in David Johnston now, please.
Thank you, Chair. Good morning, Secretary of State. In September, the department issued a tier system to manage school openings, where you could move from having a rota for different children to attend school at different times through to wholly online learning. Whose decision was it to move away from that system, and why was it taken?
Well, the decision to move away from that system was obviously done in conjunction with Department for Health, Public Health England, and also through the formal process of the COVID-0 committee that obviously convenes all parts of government. We in terms of the sort of design of these systems, these are never done in isolation purely with the Department for Education. It's actually done most critically and importantly with the Department for Health and Public Health England to make sure it sort of meets the need. And what we were finding is that in terms of working with the Department for Health and Public Health England, we felt by moving to the contingency framework, we felt that this would be a better way of doing it. And actually having spoken with the sector and their experiences of operating schools throughout the first few weeks, through the June and July period and then into the September, we felt that, and with the full opening of schools, it felt the contingency framework best met their needs, and it also worked best with the Department for Health and Public Health England.
And is that what you, before I go on to my other questions, is that what you imagine we will revert to when schools come to reopen?
Yeah, so we already have the sort of set scheme in terms of a contingency framework. Obviously, where I would, as I've said many times before, I want schools to be closed for the shortest period of time available, but the contingency framework would be sort of sat there as, if to sort of continue, if there are areas of particular need where we had to have school settings continue to remain closed, it would be through the contingency framework that they would remain closed.
Okay. You issued a temporary continuity direction to Greenwich Council on the 13th of December, and I happen to support your determination to keep schools open, but people have understandably asked on what basis you made that decision, given where we find ourselves now with children having to use online learning anyway.
Yeah. So David, it was, as you can imagine, right across the north of England, right across the Midlands, we've seen many local authorities and many schools having to really tackle very high levels of COVID infections. And what's happened on every one of those occasions, we've been in a situation where we've worked really closely with those local authorities where they've had particular concerns. And we've dealt with dozens of local authorities where they've had particular concerns, and we've never been in a situation where we've had to move a direction, because what's always happened is those local authorities have come to us, we've had detailed discussions, we've looked at working with Public Health England, working with the local director of public health as to how we deal with some of those challenges. Sometimes that's meant schools closing where there's been particular challenges, but we've really taken the approach of partnership working. And you've had areas of the country with case rates of over 800, whereby working with the local authority, we've been in a position where we've been able to keep schools open and protect children's education. What we had in the situation with Greenwich is, there was no conversation, there was no discussion that Greenwich had flagged up an issue beforehand. And, usually these have been flagged up by the directors of children's services, directors of public health. This hadn't been the situation in Greenwich. And we found out by, a sort of clear announcement that this was the approach that Greenwich was taking when they had a case rate load of, 250 per 100,000, which wasn't that different from the all London case rate, and it certainly wasn't one of the areas that had been flagged up to us by Public Health England or anyone else. We're obviously also in a position where the knowledge of a new variant was certainly not something that we had any understanding and knowledge of. And you'd seen authorities and schools right across the north of England, right across the Midlands, being in a position where we'd had this amazing partnership working, where we'd worked together, dealing with some really tricky issues and case rates much higher than we're seeing in Greenwich, and being in a position where children were able to continue to get in education. So it would have been remiss of us, and it would have been wrong of us not to take action where there was a local authority where case rates were just so much lower than all those other local authorities right across the north, right across the Midlands, where we'd had that partnership working together to keep schools open, but taking action where was necessary to help them and support them in the containment of the virus. As I say, at that stage, none of us were aware of the new variant, and we were not aware of the impact that that would ultimately have in terms of case rates and the impact more widely right across the country and including in London.
Okay, thank you. Could you just quickly describe for us how hotspots are brought to your attention as Secretary of State?
Well, of course, we have a very detailed bronze, silver and gold command structure that is run by the Department for Health, where local authorities, directors of public health in those local authorities, regional directors of public health, the NHS, and obviously the Department for Health and Social Care and other interests are sort of represented on there, and that is the mechanism that it would be flagged up. But also we have a lot of dialogue with local authorities who, as I say, in so many cases that we'd seen from all the way from June all the way through December, where local directors of public health were having regular discussions with regional schools commissioners, highlighting where they had concerns, and we were taking action wherever we could do to help support them in terms of tackling COVID.
Okay, and last question from me for now, which is more a long-term one. What's your assessment of what we've been through with education in the last year, the impact it's going to have on the disadvantage gap? Because some estimates say it's going to wipe out the progress we've made in closing the disadvantage gap of the last decade. I mean, what's your view of the damage that this is going to have done?
I think the DfE officials said the attainment gap could be as much as 75% between disadvantaged pupils and their better off peers once COVID is out of the way.
This will be one of the greatest challenges that we face over the coming years, and how we take the action to make sure that this pandemic does not hold back the progress of children from whatever background that they come from. we are got to ensure that this pandemic does not scar the lives of children we've got to take every action that we can do to really, we saw that with the COVID catch-up fund. We're seeing that with the national tutoring programme. We must not rest in terms of doing everything we can do to be closing that disadvantage gap. And this is why I will never make an apology for being the greatest champion of opening schools, because actually all the interactions that we know make the greatest progress and have the greatest impact on children mean that schools are open and children are in the classroom. And that is why I must never apologise for being the greatest champion of keeping schools open, because I know it makes such a big impact, and it makes the biggest impact to the children from the most disadvantaged. But where we take action, it has to be evidence-based. This is why schemes such as the National Tutoring Programme, when we roll out further initiatives, whether that is, sort of more support to ensure that and support learning through the summer for children from disadvantaged backgrounds, these are the actions that we will have to undertake, because we know that they can make a real difference to children's lives, and we must be relentless in
Okay.
to close that gap.
Thank you. You've been great with the old concise answers, Secretary of State. If you just keep it up, it would be appreciated.
I will endeavour to be more concise.
Thank you. Ian, before I bring in Jonathan Gullis, Ian has a question on truancy. Ian Mearns, please.
Yeah, truancy, Secretary of State. I mean, the trouble is, it's how we couch this in language, because there's attendance and there's absenteeism or non-attendance. And, I think the general understanding of the bulk of the population of truancy is where children are bunking off without their parents' understanding or knowledge. Whereas, there is an awful lot of absenteeism which has been occurring within the current context, which has been either parentally condoned or parentally supported. And I'm just wondering, have you done any sort of analysis of what the attendance rates have been and how much actual truancy there has been where kids are bunking off without their parents knowing? Because I think that's important in terms of understanding the problem that we've got to deal with in terms of getting kids back into the classroom. And the second part is, what's being done to support the learning of children who don't currently have a school role? In other words, they've been off-rolled by a previous school, or they've never got onto a school role in areas of high demand, which is still the case with some children in some parts of the country.
Ian, really important points. And actually, the only way we can get to a solution is schools play a vital role in it, but it has got to be a collaborative approach across all agencies. And we often fall into the habit of saying this is purely a school problem. Actually, the consequences of that long-term absenteeism, either by sort of almost, parents not being the driver to make sure their children are attending school, or where it's happening without the parents' knowledge. The only way we can really tackle this, yes, schools play an absolute pivotal part in it, but it is working. It's really also working with local authorities. It's working with the police, but it's social care. But it's also working with health as well, who will often have a sort of a good picture of sometimes family circumstances, especially of those children in the earliest years. What we're going to we're working with local authorities in terms of providing the data of where there is that absenteeism. So actually, by providing that data, obviously it's held by the schools, but it's really important to share that data across with local authorities, who again have some of the levers to be able to work and have an understanding of how we can tackle this challenge together. And we're working on the sharing that data in future releases going forward again, so local authorities have the tools to do the job, and we'll be looking at publishing that data for the autumn term on the 19th of January. so not too far away. And I think that will be, I think it gives a sort of really important insight and a really important tool. But I think longer term, we mustn't be we mustn't be neglectful of the real challenge that we're going to have to face in terms of how this cross-government working is going to have to do. And family hubs, I think, are going to play a really important part in actually tackling some of that disengagement.
Thank you. Jonathan Gullis, you're on a train, so if you cut off, we'll bring you back later on. Jonathan.
Thank you very much, Chair, and thank you, Secretary of State.
Well, I'm going to, I could maybe make up Jonathan's question at this point.
Jonathan, if you text me the questions, if you can't, if the internet connection isn't good.
I would not going to go beyond.
It's not working, unfortunately, Jonathan. So what I'm going to do is I'm going to move to, I'd like to move to Christian, please. And we'll come back to Jonathan if you can get an internet connection.
Thank you, Chair. It's difficult to follow that. Good morning, Secretary of State. In regards to the decision that was made in regards to mass testing of secondary schools, for many schools, this was taken up on the last day of term. Some schools had already broken up by that point. So in regards to the decision, why was it thought that was an appropriate time to make that decision, and why was the announcement not brought forward or put back? So it allowed more time to one, be understood, but actually to be implemented fairly.
So as you'll appreciate, I think all members of the committee will appreciate, in any global pandemic, things move at incredible speed, and we were in a situation where we could be able to, at that stage, an offer to school that wasn't going to be a compulsory offer, but it was an option that they could take up in terms of testing. And obviously, we wanted to be able to get that offer out at the very earliest stage. I very much recognise that that is not the time that any school wants to be able to get that type of information. It's not the situation we ever wish to be in. But we were in a place where we were going to be able to offer them a full testing regime that they're able to take up. We were going to be in a position to be able to offer the financial support for them to be able to roll it out. And it felt the right thing to be able to do, because there was, of course, by that time, and I'm sure you're aware, the Health Secretary had, by that stage, made a statement to the House of Commons about the emergence of a new variant. And it felt that it was going to be an important tool in terms of supporting schools, supporting workforce, and most importantly, in supporting pupils in order for them to be able to get back into education at the earliest possible stage.
Thank you, Secretary of State. In regards to those areas that had high prevalence of the virus prior to the lockdown, I think predominantly of the Northwest, the Midlands, for example, where before the second lockdown we were up to over 600 cases per 100,000. At any point during that surge, was there a push from the department to try to implement mass testing in schools? And if so, what was the Department for Health's response in regards to that?
So we've been wanting to roll out mass testing at a very early stage, and we have we've seen mass testing rolled out in schools in a number of areas. The first one, of course, was Liverpool as part of that, and schools played a really important part of that community mass testing response. What we did following that is we quite understandably did an extensive number of pilots across the country in very different types of schools, in very different types of areas. Because obviously, if you're wanting to roll out a mass testing program, we wanted to see as to whether it was feasible and whether that would deliver results that were of value to public health and also work for the schools. The pilots that we ran across the country came to a conclusion at the close end of that term, which meant that that was the first time that we were then in a position to be able to start to roll out, start to look feasibly at the rollout of mass testing, because we obviously had to test those pilots, see what worked for the schools, see what worked for pupils, and whether it's feasible to do it. We found out that it was, and the evidence from the first, week or more of schools operating testing regimes, we've already had hundreds of thousands of positive tests, hundreds of thousands of tests come back of testing children. So it does show this is a system that can work in both schools and colleges.
Thank you. In regards to the testing, obviously it's very helpful to be rolled out to secondary, but the number of secondary schools, but the number of children who've missed days of education, not just in the secondary setting, but in further education, in primary education, and in early years education. What thought is there to actually extending mass testing to cover all education settings and not just secondary?
So the mass testing already includes further education colleges, and part of the drop of tests, it wasn't just to secondary schools, it was to all education establishments, secondary and further education colleges and sixth form colleges as well. They all have received the initial drop of tests on the Monday, the 4th of January, with further tests coming forward. I want to see mass testing rolled out across all education settings. On the next, what we're seeing from, the 18th of January, you're going to see the rollout of staff testing for primary school teachers. Testing is a really important part of bringing children back into school. It's also a really important part of not just making schools as safe as possible, but actually fighting against COVID right across the community. Because if we're testing a child, in essence, we're also in a position where we're testing a household as well. I think...
In a nutshell, are you going to extend it to non-secondary school settings as well?
Well, we've already extended it to further education colleges and sixth form colleges. We're extending the parental testing, the staff testing as of next week to primary schools, and I would like to see it sort of rolled out to all pupils. That's my ambition. That's where I want us to get to.
Okay. Thank you. Christian, have you got any more questions?
Yeah, one final one, Chair. I mean, given the call on teachers and support staff time in the classroom, obviously teaching those children who are in school, but also providing education for those who are out of school in regards to virtual lessons. What extra resources are being given to schools to actually carry out the mass testing on a weekly basis?
So where we're moving to in terms of the testing of staff in primary schools, these will be tests that teachers will be able to do at home. So they'll be then in a position of actually they'll be able to be self-administered at home for the teachers and support staff to be able to do. In terms of the rollout of the mass testing, there's a £78 million package and being able to support schools in terms of doing that, as well as other additional support that we've put in place.
Thank you. I've got a quick question from Dr. Caroline Johnson before we bring in Ian. Caroline.
Thank you, Chair, and thank you, Secretary of State. Two questions very quickly in relation to some of the answers you just gave to Christian. Firstly, you talked about a £78 million package to support schools in terms of delivering these tests. You also talked about how it's fighting COVID right across the community, but these tests are voluntary. Why has the package not been given to support independent schools in delivering what is a health rather than educational measure to ensure that every school participates and we protect all children regardless of their parents' educational choices from these health challenges, which when health is free at the point of use?
Of course. Now, if I can bring Susan in, but just to add that we're actually supporting all education settings, including private schools, with the provision of all the testing kit and all the equipment as well. But if I could just bring the Permanent Secretary in, who just wanted to make a point and also pick up a little bit more on what you just asked. Susan.
Thank you, Secretary of State. So it was really in relation to the last question to say that rolling out testing in primary schools, we're working very closely with PHE, with Test and Trace, and actually with the MHRA, because for primary pupil testing, being able to administer getting to the point where parents can administer the tests at home unlocks the ability to do primary testing at a much greater scale in a way that is more straightforward, but also we think is more appropriate for primary school children. It was just that point that I was going to add. On the independent schools, just to say they are getting the provision of all of the test kits and materials. The aspect of support they don't get is the support for staffing. And of course, that's consistent with the fact that we wouldn't pay for independent school staff for any other purpose.
Is that entirely accurate? Because I could just say, if you were delivering the vaccination schedule for senior school pupils, perhaps girls, to have the Cervarix vaccine for HPV, then the NHS does provide that service, and that's why I was raising this as a slightly odd thing that a health provision isn't being provided to all students, regardless of parents' ability to pay for it. The other question I had was really about the primary school rollout, because as a paediatrician, I'm aware that performing tests on older children is significantly easier usually than performing tests on younger children. And yes, the tests are very easy to perform. I have a box in my own house to do as an NHS worker. What's your plans for trying to ensure that younger children particularly can be tested? Because obviously having a teacher trying to do a whole row of them would seem to be incredibly difficult. But when I spoke to the primary heads of my local primary schools, they had very mixed feelings about whether they should be done in schools or by parents.
So I don't think it would be right or appropriate to ask school staff. Obviously, in a secondary setting, staff are supervising the test done by pupils, whereas it's not going to be in a primary school setting. If you try to have a similar approach, you'd be having to ask staff to do the testing themselves, and I just do not believe that's appropriate or right. So what we'd be looking at doing is having a system where it is tests that would be carried out by the parents on their child, as against asking staff to do it, and that would have to take place in the home. Susan, I'm not sure if there's anything further you wanted to add on that.
Only two things on that. So the first thing is that's something that we are going to pilot before we roll it out fully, in order to look at some of the issues around making sure that it's possible for parents to do that and that we can understand test fidelity and other issues. And we're working, as I say, with PHE, Test and Trace, and with the MHRA on that. I mean, I think the other thing that's worth saying is if you go for a PCR test in a community testing centre, then for primary age children, the procedure there is that a parent performs the test on the child. So a parent swabs the child. They do it under supervision, but it's, in a sense, this is consistent with the position on other testing.
Thank you.
I'm just going to, Ian, Fleur has a question on testing. So Fleur, please.
Thank you, Chair. I'd just like to ask about the early years sector. You haven't mentioned them in the testing regime, and I think anyone watching will be wondering if where they are in it, and there is confusion at a council level. So can you confirm that the early years sector, state-maintained nurseries, private nurseries and childminders will be included in the testing regime at the same time as other teachers? Thank you.
Well, they're very much included as part of a community testing programme. Obviously, where schools have nurseries as part of them, that will be part of the sort of school staff. But one of the key parts of a community testing programme will be actually ensuring early years workforce have access to that testing.
So will that be at the same time as other teachers?
That will be at the same time as the rollout of a community testing programme, which was announced the other day.
Thank you. Fleur, are you okay?
Well, it's just that certainty that they're seen as a parity of other teachers, like state-maintained nurseries are just happen to not be attached to a school, but they don't seem to be considered in the same tranche as other nursery teachers, and there's a bit of confusion there. So
So the whole community testing program was making sure that we actually pick up the early years settings, because we recognise how important it is. And as you'll be as aware as I am, there's such a range in terms of numbers of staff and the ability to sort of reach them, because obviously you have some nurseries that are very large, others that are very, very small and almost, one or two people operating them. So it was felt the best way of being able to reach that whole breadth of them was through the community testing program and be able to deliver testing through that.
Okay, I just think that needs to be clarified at a council level, because it's leading to confusion about whether nursery school teachers are included in nurseries and private and.
I'll certainly take on board the task and task officials to make sure that that's clarified with local authorities. Obviously, as I say, through many of sort of educational establishments in terms of a rollout of school testing, there's an ability to pick up a lot of nursery settings as part of that, but there'll be a number that we need to have a community testing program in order to be able to pick those settings up for us.
Okay, thank you for taking that up, Secretary of State.
Thank you. Ian, who's been waiting very patiently. Thank you.
Thank you very much, Rob. Secretary of State, in answer to my earlier question, I don't think you really covered the issue about off-roll children. I was wondering if you could write to us about that in more detail in terms of what's actually happening in terms of provision for off-rolled or children without an allocated school place, which there are still some around the country from last September. If you could maybe let us know what's happening about them.
Of course, I would more than happily write to you about in detail on that important issue.
Right. Secretary of State, what practical help and support are you providing teachers and school staff during this unprecedented time? Particularly, what access have teachers, support staff and pupils to mental health support? And I'm really, we've covered pupils earlier on, but I'm not sure if we looked at, the support that the teaching staff and school staff in general would have during this time. And there's an additional reason I'm asking that question, because since the new lockdown, I am certainly aware in my own locality of a massive additional stress being placed on teaching staff and management staff in terms of having to allocate the places which are available. Because if we're going to be successful about managing social distancing with the children who are allowed to come to school, there are huge demands from parents and, of course, from vulnerable children as well, in order to come and get those places which might be available. But it seems to me that if we acceded to all of that demand, it would defeat the object of social distancing in the classroom and in the school context, because, frankly, some schools in my area are reporting that 85% of the children, the parents are asking for places because they're key workers or they're vulnerable children, they haven't got a device or all the rest of it. So that's an additional stress. So what are we providing in terms of that support for teaching staff and for staff in schools? And what are we going to do about that real tension there? Because as Susan pointed out before, there is a lot of discretion being given to schools over that, but that's an additional management burden and real demand from parents demanding basically that children be allowed in.
Yeah. Well, I think we need to be guided by the clear data that's emerging, and in terms of attendance rates nationally, they're running at from the initial cut of data that we've shared today, that's running at 14%. You're right to highlight there will be particular areas where they're actually close to a hospital, close to critical industry, where there are a much higher rates. And what we want to do is work with regional schools commissioners, work with those schools as how best we can support those schools in order to be able to support those children, either they're vulnerable children, they're the children of critical workers, to be best able to support them, to be able to be in the classroom if that's where they need to be. And we'll work right across the sector, both with, as I say, not just with the schools directly, but also with unions as to head teachers unions and everyone else as to how best we can put the support there for schools to be able to manage that. And actually also with local authorities, where there may be particular challenges within local authorities, and actually you know, one of the great things about our education system is the amazing spirit of collaboration between schools, where sometimes there's an element of rivalry, but equally there's more often not a clear understanding of actually how one another plays an important role of supporting the other. You raise a really important issue again about mental health. When we had rolled out the Wellbeing for Education return training, it was really important to pick up staff as well as pupils. And we've also funded some additional education support for mental health needs of school leaders, because the real heroes, head teachers have been amazing heroes during this pandemic. They've not had really any respite at any moment through this, from the moment that schools first had to make those changes back in March, through the holidays, getting ready for a full return in September, and having to continue to deal with those challenges. So we have recognised some of that need, and 85% of local authorities areas in England have told us that they're delivering additional training and support into local schools and FE providers. And it's important for us as a department to work with them in terms of those discussions of how we can support them in terms of delivering that support.
Just an additional thought, though, but the new variant, I'm afraid to say, is no longer confined to London and the southeast. My own director of public health told me that within the last week or so, 55% of those people who've tested positive have the new variant. And of course, the new variant is much more transmissible. And of course, teaching staff and teaching school managers and other school support staff, are at home. Parents, partners, wives, husbands, daughters, sons of people who they live in the household with. So with that new variant and the transmissibility, obviously there is extra additional worry, that if schools do become over full, that the likelihood of transmission really does magnify, and that is, it's a genuine concern expressed to me by many teachers and school managers.
Ian, as you I know that you're aware of, is that the reason that schools were closed were to take the overall approach of reducing movement across all of society, not because the chief medical officer, deputy chief medical officer are the greatest advocates for having children in school because of the amazing benefit, but we did have to make that decision in terms of reducing movement.
Sorry, just to I beg your pardon for interrupting, but we were told just a few days before the school closures by a survey from Public Health England, as I understand it, that actually school closures had a marginal effect on the rate of transmissions.
And where school closures, because as we've always, schools are the best place for children always to be, and they're a safe place and a safe community with the measures that are put in place. But the reason that the decision was made when we reached a COVID alert level 5, and we were seeing that incredibly strong spike in cases, it was a measure that would reduce movement among the whole community. And it was an additional measure that we always, as you can understand as Education Secretary, it is not a step that I ever wanted to take, and would have, we were taking some quite, extensive actions to try and avoid that, including the rollout of mass testing. But the advice was that it could play a useful role in terms of actually reducing movement in community and ensuring that this national lockdown had a greater impact in terms of suppressing the virus. But Ian, in terms of, the data does bear out that actually it has had the impact of the fact that only 14% of children are in school. So it has had that immediate impact overall. But it is really important that we continue with our testing regime, because that plays, again, a really important role as one of the measures for ensuring that we tackle COVID, from do everything we can do to stop it coming into school, but also helping make sure that people are aware that they have COVID wider in the community by doing that mass testing.
I think Secretary of State, though, you do need to clarify that 14% number, because I'm certainly aware that in my own locality here, many more than 14% of children have access to some schooling, possibly on a rotational basis. And I would be interested to see what the actual number of children who've got some input into schools, actually attending school, even on a rotational basis would be. It's much, much more than 14%.
Well, I mean, I'm just going on the data that we've collected from schools, Ian. So this was the data that was taken nationwide. And
I think that's a snapshot, Secretary of State, rather than an indication of how many children are actually having a physical interaction with their school.
Well, it was the data taken from all schools on the 11th of January.
It's a snapshot.
It is a snapshot, but it's a snapshot that we do every single day. And I think,
but I think, Secretary of State, it's important for parents and for the wider population to have an understanding that 14% is not the number of children who are having a physical interaction with their school, even on a rotational basis. It's much more than that.
Well, Ian, it's actually. But what you'll see is if you're having children having a experience on a rota basis, it will obviously, when you have the data across all days, you'll have a clear picture. But this is data that's based on evidence submitted by schools. But maybe if I could just bring Susan in just to comment on the data and the veracity of it.
Yeah, so this is the collection that we do daily. It was made reference to earlier that we've been doing attendance collections through last term, and that we changed the attendance collections precisely so that we could understand the picture under these new circumstances and collect information about vulnerable and critical worker children attending school. Mm-hmm. The picture is that overall 14% of the total cohort were in schools on Monday.
A particular day.
But we collect it every day. Yeah. And so we'll publish the data as we have been doing. Mm-hmm. I don't think there's hugely widespread use of rotas. I'm very willing to be to hear more about that from schools and so on. But in terms of the question you're raising, which is how far are we reducing movement in order to help reduce transmission, the number of people who are moving on any one day is highly relevant to that. So what we've effectively done is we've taken 85% of the movement that's due to schools out of the I think what you may be hearing is that there's quite a different picture for primary and secondary schools. So within that 14%, attendance in primary schools averages closer to 20%, and attendance in secondary schools averages closer to 4%. And further, we also saw lots of people raising concern about individual schools where levels of attendance were very high. And again, we've looked for that very closely in the data. Actually, what we see is that the proportion of schools with more than half their children in is around 2%. There are a small number of schools out there. As the Secretary of State said, they may well be schools that are next to a hospital or near a place, for example, schools in the docks where people are handling food. We need those people to be able to do that in order to keep people fed and healthy. But it's a very small proportion of schools. And the public health advice we have is that the key driver, the reason for closing schools, was to reduce that overall amount of transmission, and that they are comfortable that an individual school may have higher levels of attendance than another. As long as the school has the same measures in place that they had last term when they had all children in, they're comfortable that that is a perfectly reasonable thing to be doing, as long as the overall numbers across the whole system have come down significantly enough to help us reduce that movement. So those numbers that suggest we've reduced that by 85%, we'll clearly be keeping a close eye on that. We're also able to look at what proportion of those who've requested a place have been given one. And again, we want to work with schools that are worried. So there's three issues, aren't there? There's transmission across the whole of the country and how schools play a role in that. There's an issue about individual school safety, which also plays. And again, just trying to make sure people are comfortable that, again, the public health advice we have is there isn't a sort of proportion limit at which you become unsafe. It's about the measures you've got in place in your school to manage the children you have in. And then the third issue is about the practical management of that. So we know that for some schools, they were expecting much lower levels of attendance, and they'd organised themselves in a way that meant that managing the children who were in school and the children for whom they do remote learning was difficult.
Yeah.
And what we're doing is working through the RSCs with schools to help them find the models and the ways of working that will help them manage sensibly and safely for all those children. So we can educate the children who do need to be in school, and the children who need to be educated remotely, and we can do that sensibly and well. And we want to really support schools in doing that. We completely understand that this is really difficult for people as well.
Thank you. Just very briefly before I pass to Tom, on the 2nd of January, the Department for Education sent out to myself and some other MPs saying that the Public Health England survey with the London School of Tropical Medicine, of Hygiene and Tropical Medicine, said that school closure would only have a minor and temporary effect on transmission rates, and the wider impact of this on children's social, physical, educational and emotional development would be significant. And that was sent out to us on the 2nd of January, based on, as I understand it, looking at the new variant of COVID. What changed in a few days that schools suddenly closures would have a dramatic effect on transmission, whereas on the 2nd of January, the PHE advice was that it has a marginal effect?
Well, Robert, we're all incredibly committed to making sure that sort of schools opened, and we saw an incredibly high proportion of schools open in non-contingency framework areas on that 4th of January. But when the Prime Minister had received the advice about the change of moving to COVID alert level 5, and also the most recent data, it was a decision that felt that needed to be taken, that the place that we never wanted to be in, the situation where we, it's always been a national priority to keep schools open. For me, it's always been clear they should be the last things to close and they should be the first things to open. But it became clear as a result of that further data that was coming in, that it was a decision that would have to be taken because it would play a role in suppressing movement within the communities of which schools are, and would play a role in helping suppress the virus. But it was something that was done with no reluctance.
So because of the schools, that was only 2 days later that this evidence changed. So the Permanent Secretary, I think, wants to say something, Secretary of State. Susan.
Yeah, thank you very much, Chair. So my understanding is that the PHE evidence, though published on the 2nd of January, related to a period earlier in the autumn term before the new variant was dominant. But I think the second thing that changed was that even marginal changes in transmission started to become very salient because of the reproduction rate of the new variant, but also because of the pressure we were seeing on the NHS. So the thing that happened on the morning of the 4th of January was that shift to level 5 for the NHS, and that moment where we were clearly told the NHS was under extreme pressure. And at that point, even things that had an effect that in the past we had considered to be outweighed by the benefits to children of remaining in school, we started to be advised we really have to do everything we think could have an effect of any significance. So I think there are two things. I think first, the assessment of effect size changed a bit with new variant, but second, we moved from a place where doing something with a relatively small effect wasn't outweighed by the benefits of children remaining in education. People were saying we just had to do anything that might have an effect.
Thank you. It would be good to know, and we will question next week whether the survey was based on just purely the old variant. For sure. Tom, been waiting incredibly patiently. He's going to ask his questions plus Jonathan Gullis's.
A lot of questions.
Yeah,
Secretary of State, couldn't agree more. It's a very challenging situation for teachers who are required to, teach online, but also, in the school at the same time. Very challenging, very stressful, I can imagine. But it does seem that, last time schools closed, most schools did a brilliant job. But sadly, most of the surveys that we've seen would indicate there have been some occasions where this wasn't the case. I think your view is that Ofsted should play a much more sort of proactive role this time in ensuring that there is good quality across the board. And I've seen some detail on this, but I'd be very grateful if you could outline sort of practically how you expect this to happen, and if there is a particular school where it seems as though they're not really stepping up, what actions would be taken. And the other question I've got is in relation to live online lessons. I have seen that there's been, I think, some of the teaching unions have expressed views on this, about how that they've got concerns about live online lessons and what this might mean for privacy. I've seen others who think that actually live online lessons are very important because there's a degree of interaction you simply don't get when it's pre-recorded. And especially, it gives young people the chance to interact with their teachers and other members of the class, etc. Just wanted to know what your views are on those two key points.
Well, thank you very much, Tom. So I think we've seen a real massive step shift in terms of the offer and what schools are providing in terms of remote education for children since March of last year. And even in March, April, May, there are many schools that really were trailblazers and led the way. And they've started to set the standard as to what we want to see in all schools. The reason that back in last year we set out our expectations of what remote education would look like was because we did recognise the fact that there was a very real possibility that schools could be closed again. And I know that that was a controversial thing to do that did meet with some opposition, but I firmly believe it was a right thing to set out clearly what standards were expected. And all schools and FE providers are expected to publish information about their remote education provision on their websites by the 25th of January for schools and the 18th of January for FE providers. As I say, I think we've seen a seismic shift in terms of what is being delivered. And it's a real tribute to the teaching profession, the whole school community who've really embraced this and actually doing wonderful things. And then you have the additional support of the Oak National Academy, which we've invested in heavily. And if there are issues in a school or a parent has, we would always ask that parent to have that conversation with a teacher to sort of try and resolve it and to sort that out. If that isn't resolved, we'd then ask them to have that conversation with the head teacher in order to be able to resolve it and sort it out. But there is a duty on us to ensure standards in education, and a little bit like what we expect in terms of children in a physical classroom. If the education isn't being provided to the standards that would be expected, then we have to accept the fact that there has to be some form of recourse, and the ultimate last form of recourse would always be Ofsted, and that would be the same in this one. But we would, that is, certainly not something that we, firstly, people shouldn't be going to as a first stop, and it should only be very much a last course of action. In terms of live online lessons, and this is where the development of remote education has moved so rapidly, I think that live online lessons can be an important part of the whole package of what teachers and schools are able to offer. And it's certainly something that sort of, we'd encourage them to sort of see as part of that whole package of what they can deliver children.
Sorry, a final couple of questions. DfE guidance indicates that children without access to remote learning can be treated as vulnerable and attend school during a lockdown. Is this provision being adhered to by schools and head teachers? What impact is it having on the numbers attending school and on teachers? And finally, a question about teacher recruitment and retention. This was a big issue before the pandemic, but obviously I just wanted to know what your thoughts are about how you think this pandemic may have impacted or may impact the government strategy for teacher recruitment and retention going forward. There may be some aspects actually which is quite helpful, because the role of a teacher is being at the forefront and the heroic way in which many of them have carried out their business. But on the other hand, the amount of stress that many teachers have been put under, I guess the concern is that some may leave a profession and some might be put off going into it.
Yeah. Sorry. So in terms of the allocation of vulnerable, sort of those children don't have access to laptops, the data would indicate that, as I say, an overall 14% of pupils in attendance, and doesn't seem to have indicated that there has been an abnormal impact on it. We do leave schools and leadership of schools to make a judgment, and obviously, where there are families as are in that difficult situation, we would really very much hope that teachers, the schools would able to work with that family to help support them. In terms of teacher recruitment, it looks as if the teaching profession, what people have seen sort of firsthand about the amazing job that teachers are doing right across the country, the important role and the important impact that they're having on children's lives. What it is actually showing is it's really driving teacher recruitment numbers, and we're seeing a large increase in the number of people who are wanting to come into the teaching profession. This is, really positive signs in terms of substantial increases in the number of children, number of people who are leaving university, doing PGCEs, taking on the initial teacher training, really driving numbers up. We still recognise we face challenges within some of the most difficult recruitment areas, but we still have a strong package to really highlight what a brilliant career teaching is. But the numbers are incredibly positive, and I'm confident that
Secretary of State, we've got loads to get through, and I just
Secretary of State,
please, if you just do it in a nutshell as much as possible, it would be great. Okay, Tom, have you finished?
That's me done. Yeah.
Yeah. Do you want to please ask Jonathan Gullis's questions? Some of them.
So one of the questions was about this potential additional pressure on school budgets. Many schools, certainly a number in my constituency, have really gone above and beyond when it comes to making sure that when they were open, the environment was safe and secure. It was regularly cleaned. There was adequate measures in place to make sure everyone was safe, both pupils and teachers. This has meant it's an additional cost to them, and I just wanted to know that in future whether this would be taken into account.
Well, you saw in terms of the first, saw in terms of the first national lockdown where schools were closed. We put a package of measures there in order to support schools during that period. Over 14,000 claims were lodged with the department, 14,075, and so far 13,000 schools have received payments, in terms of reimbursements, and obviously working through the final ones of those. We also put a package of support for the winter, sort of going up to Christmas, and we'll be looking at actually what additional help and support is required for schools. We are very much recognising that they are actually having quite acute pressures. We understood that when we were rolling out the testing regime, and recognised there needs to be a financial package put in place there to support schools when they're fully rolling that out. and there will no doubt be pressures on school budgets as a result of some of the things they're having to do. We've made it very clear in terms of preschool meals, if there's locally derived vouchers, we're covering the cost of that. We're putting extra payments in terms of school food if they're delivering those food parcels locally within the school. That's why we're putting the national food voucher scheme will be online from next week for schools to be able to use. But we do recognise as we go through the coming weeks, there'll probably be further measures and further support that will be required.
Thank you very much, Secretary of State.
Thanks. I just want to read a question from Jonathan Gullis, whose internet connection is not working. Will the Secretary of State understand the frustration felt by both teachers and parents over who can and cannot be in school at present? Many schools are rightly using health and risk assessments from lockdown 1 and therefore limiting sizes of pupils in classrooms, yet who is eligible to access school is broader and vague. This is causing conflict between parents and school leaders unfairly. So what can be done to resolve this? Schools in Stoke and Kidsgrove in his constituency are telling him that due to those student numbers coming in, they might as well be open to all pupils as all staff are having to still come in. Could you comment on that, please, Secretary of State?
Of course. Well, firstly, the guidance that we have in terms of critical workers has been very consistent from the initial guidance that we issued back in March of last year. There have been some small changes. I think the eligibility of number of workforce that potentially have come into scope is 11,000 nationally, but it has been largely static from where it was before. We are starting, as I say, we're getting the first cut of data, both at a national level, at a regional, local authority level, and also at a school level. And what I've asked regional schools commissioners to do is to target those real hotspots where there are challenges and actually how we can work to support schools. Firstly, to put them in the best position to be able to make the full provision that's needed for those children who need to be in school, but also to work with local, those local schools, but also local authorities if there's particular concerns around the impact and deliverability on that. And we're very confident that we can work through some of these issues. We think it's a small number. The initial cut of data indicates there's actually quite a small number of schools that will be facing that challenge, but we don't underestimate the challenge that those schools are facing and how we work with them, support them in order to deliver the places for critical workers that need them, but at the same time making sure that this is done in a way that's sustainable for the school.
Thank you. Can I please bring in Kim, who's waited a long time? Thank you.
Thank you, Chair, and good morning, Secretary of State. I've got some questions in this section on connectivity and laptops. So it's estimated that over 1.7 million children suffer from digital poverty. So what estimates do you have of the number of disadvantaged and vulnerable children who still remain without a device or internet access? And will the government consider rolling out free Wi-Fi access to all families in receipt of universal credit so no child is left behind? Thank you.
Well, Kim, it's so incredibly important that the actions that we take in terms of devices and access to, access to the internet. That's why at the start of the pandemic, we made the bold decision to actually start investing in digital devices. By the end of this week, we will see a total rollout of 750,000 devices to schools across the country. In terms of looking at the numbers that were required, Kim, what we had done is we used the latest data that we had in terms of the amount of laptops and tablets that are available in the sector. That's about 2.9 million devices that already sit within the sector. We've made a commitment to procure on top of that 2.9 million devices, that additional 1.3 million devices. The rollout is going very well. We believe that actually with such a range of devices within the sector, it puts schools in the best possible position to be able to support children that maybe don't have ownership of their own device or access to one in their own home. Again, you make a really important point about internet access. We had trialled during the first stage of the pandemic a number of approaches working with BT and other providers. What we found was the most beneficial to most families was working with mobile access data partners in order to be able to increase the limits. This has had a real big impact on for many young people. And, I'd always like to take the opportunity to thank EE3, Tesco Mobile, Smarty, Sky Mobile, Virgin Mobile, O2, Vodafone, BT for what they're doing.
Okay.
Also the measures to no rate.
Okay, got it. We've got to get the next question, Kim, please. Thank you.
Yeah, and I think I appreciate that so many devices have been sent out and issued, Secretary of State, but members on this committee are still hearing from schools within our constituencies that are still received access to resources. So it would be useful if you could let us know what DFE information is available and whether you could share that with this committee, please, Secretary of State.
So Kim, by the end of this week, all schools will have received their full estimated allocation of devices. But we do recognise there'll be some schools that are in a position that maybe haven't got the number of devices in schools that they would have procured over a period of time, and that's why we've continued to invest in devices over and above that estimated level that they'd need, so that schools are able to come to the Department for Education where they do have specific needs. We've had over 400 schools make requests on this basis, which we've looked. And of course, we're very happy to share with the committee the working that we did in terms of the initial estimates of the procurements that we made and how actually we're best in the best position to support digital devices.
Thank you, Kim.
Also, Secretary of State, we've heard that those laptops that have been issued to schools have to be wiped by teachers because they don't have the necessary monitoring systems in place so that children can't access inappropriate sites. And so the schools have had to install their own systems. Can this be reviewed and fed back to the committee as well, please?
Kim, if you wouldn't mind, do you mind if I just bring in Susan on this one, who I think is wanting to come in and speak to it?
Okay.
Thanks very much indeed. So we know that lots of schools already have in place different systems that they use. And so the basis we've done this on is first that schools can select the type of device they want so that it fits with what they're already using in school. And second, they can manage how they set the device up so it fits, as I say, with existing devices they might have in school, so it can be part of their system. But I'm very happy to look and see whether there is more we can do within the department that would be sensibly done across all schools and wouldn't effectively just mean they had something on but they wanted to take it off and put their own thing on because it fitted with what they were doing in school already. So we're really
I think that would be useful. Thanks, Susan, in terms of safeguarding children. That'd be great if you could let us know. That'd be great. So
use their own different things, and so we're trying to be flexible to what they're doing already.
I think, Kim, one of the challenges is obviously you have 22,000 schools, often with very different systems. And the ability to second guess which is the best system for every one of those schools is going to be incredibly challenging. And by imposing a system on all of them, it may reduce their operability between the current devices that they have. But we're very happy to look at that as if there's any things that we can do more that can help support schools.
Yeah, I understand the logistical issues relating to that, right? It's just about making sure that children are safeguarded. My last question in this section, will the government consider establishing a new dedicated technology budget for schools to help them tackle the digital divide in communities going forward? Because if this is going to be the new normal going forward and there's more online learning. So yes, thank you.
Kim, I sort of feel as if you're almost trying to get me to sort of engage in a debate with Treasury via yourself. But I'm gonna sort of probably sort of duck that a little bit, if you don't mind. But what we, all the actions that we've taken in terms of this mass rollout of devices really shows that how, we see devices as an important part, not just in terms of supporting children's learning while we're in a national lockdown and where schools can't be open to all children, but they will play an incredibly important role in terms of supporting children catching up, not just within school, but outside of school time as well.
Thanks, Secretary of State. Something worth considering for the future then. Thank you. Thanks, Rob. All my questions.
Thank you, Kim. Just to ask you, is there, because you'd still get a lot of schools who say they haven't got their allocation for one reason or another, or they're missing 10 or 15. Is there a dedicated helpline that they can call and that is genuinely answered? Because the schools say to me they try and get hold of the DFE and they can't get the allocation that they need. What is the situation?
So obviously, the allocation of is actually done, if it's a maintained school, it's done through the local authority. If it is part of a multi-academy trust, it is done through the multi-academy trust. There is a dedicated email that schools are able to go to. And so if, for example, if a school has a query, that would be immediately come back to, but the whole allocation for all schools will be cleared.
And if there is a problem, why not just give the school vouchers so they can go and buy Chromebooks at their local Currys? So if they're missing 17 computers, as one school told me, why not just make it very simple and just say, right, here's some vouchers, you can go down to Argos or Currys?
Well, obviously, we've been doing, one of the largest laptop procurement exercises in the world at the moment. So we've obviously been bringing in supply, but there is the supply that has sort of come into the country in terms of being able to satisfy that. So we weren't moving to a voucher scheme at present because all the information that we have is that we should be able to deliver the full allocations by the end of this week. There may be sometimes issues with local authorities passing those devices through to the school, but if that is a problem, we do have the ability to look at that, have those conversations with that local authority, the Academy Trust.
Okay, and just to confirm, either you or from the Permanent Secretary, what is the updated figure of those children who don't have access to computers at home at the moment?
Susan, I wonder if you can come in on this.
Even after your laptop scheme, what's the updated figure that you know of children who don't have access to laptops or tablets or at home?
Well, I mean, if you look at the total numbers of devices that are available to the school system, by the time the full rollout of the digital devices program is out there, there'll be an estimated 4.2 million laptops and iPads or iPads equivalent within the school system, which is substantially higher than all the estimates that people sort of put in terms of where there are challenges that people have with digital devices. So but we do recognise that, you know, as part.
Can you possibly just send us the updated figure if you don't have it with you, unless the permanent secretary has it? I don't know.
No, I'm afraid I don't.
Okay, if you could just send us, because that I think would be quite helpful.
We don't collect data from families on whether or not their children have private laptops at home, I'm afraid.
What I'm going to do, Flo, is take yours and Ian's question together so they can both answer at once, because we're behind time. So Ian, if you could go first, and then I'll bring in Flo, and then I'll ask the Secretary of State to answer them together. Ian.
Yes, thank you very much. Secretary of State, you know, I've heard what's been said about the distribution of devices and how many have gone out and how many more are ordered, but there are still schools with nil, you know, and you know, when you've got schools with nil who have got 40% of pupils on free school meals or 50% of pupils on free school meals, there's something wrong with the system there. So, you know, how can they have nil in terms of devices provided by the DfE, even via the local authority? I just don't understand that.
Well, Ian, that certainly shouldn't be.
Was I going to come?
Sorry, Flynn.
Sorry, thank you. Sorry, Secretary of State. Just add to that about data provision. So it's all very well having a laptop, but for many of the most economically and educationally disadvantaged families, they're on pay-as-you-go records. They're on GIFGAF, Leica and Labara, who you don't have agreements with, and they don't have data. 40,000 data routers have been distributed, but there's a big digital gap there as well. So is that a problem that you recognise, and what can you do to support for more data routers to be distributed as well alongside the laptops? Thank you.
So if I could pick up Ian's point, I mean, you know, all the data shows that in terms of the allocation of devices that, you know, that's proceeding very much at the pace and at that we're sort of been, you know, continue to ramp up to. What I'd ask is, Ian, is maybe if you wouldn't mind sending through particular schools where you've got an issue with, because obviously we'll have the data in terms of where it's going out. If there's an issue, we'd rather sort of look at that as against me giving you not a fully informed answer. Fleur, I actually think the routers are a really important part of the answer to that, because as you rightly say, it's great when you have the likes of EE, Vodafone, so many of us coming in, but the routers are an important part and in terms of actually having that sort of data capacity. And you know, we've delivered 54,000 5G wireless routers and continue to provide this, and we continue to look at how we can sort of upscale that, because there's not been as high a demand for them among schools as we were probably initially expecting when we initially rolled out the programme, but I think that demand is going to increase over the coming weeks, and we'll look at scaling up the capacity of what we can deliver.
Thank you. Kim now has a question on the catch-up fund. Kim.
Thanks again, Rob and Secretary of State. Many disadvantaged children have experienced significant learning loss, as we know, widening the education gap, particularly Black kids. And Nick Gibb, in his letter to the Women and Equalities Committee, claimed there is an emerging evidence of a potential for greater impact on these children, and for schools and colleges to consider the diverse needs of the cohort when providing support. So can you let us know further funding beyond the 1 billion that's already been announced to prevent children from disadvantaged backgrounds falling further behind? And what have you learned so far from the money that has been spent, and what impact has it made? And as you know, that not all learning will be online. And as a result of 10 years of austerity, community centres and libraries have closed, denying disadvantaged kids reliable, safe and free access to technology and reading materials. And will the government invest in our communities to support children to access learning outside of school, which is also very important? Thanks, Secretary of State.
Well, thank
you.
See
if you can do that, summarise that, if you can, in your answer.
It was broad and extensive, Mr. And I thought Kim was going to sort of pay tribute to the record funding settlements that the government has announced for schools over the last couple of years, but maybe she got cut short, Mr. Chairman. We're looking very closely at the real benefits and the delivery of the COVID catch-up fund. All the evidence points to making an enormous impact to schools, so many schools, not just for children from disadvantaged backgrounds, but children from all backgrounds, giving extra lessons, extended learning in the day, extended learning even on weekends and in holiday periods, giving booster sessions, and of course the National Tutoring Programme, which again is seeing an incredibly successful rollout, and we're able to ensure that it was to span across 2 years, which is really important for putting in roots. This additional national lockdown is creating additional pressures on especially those who are most disadvantaged. We want to take the evidence of what works best and actually provide those evidence-based solutions to really continue to
work that is taking place across government.
We have a substantive question to Minister Ford, who's virtual. Minister Ford. Going to take the question. Can we have a minister to answer the question, please? Or give the substantive.
So sorry.
Okay,
I'm so sorry. There was a struggle there with the unmute button. Spreading opportunity is a top priority across government, and that's why we're levelling up school standards, investing over 7.1 billion more in schools by 2022-23 than we did in 2019-20. We're committed to providing extra support for the education of disadvantaged children through the pandemic, including through our £350 million National Tutoring Programme, continuing to provide eligible children with free school lunches during term time, and by securing over 1 million laptops and tablets, of which over 500,000 have already been delivered.
We now to head to Peter Aldous in Waveney. Peter Aldous.
Thank you very much, Mr. Speaker. I'm grateful to the Minister for her reply. Coastal communities such as Lowestoft face particular challenges in improving social mobility. I'll be most grateful if my honourable friend can outline the coordinating action that is being taken to ensure that all government departments work together to ensure that children in seaside towns have every opportunity to realise their full potential.
Now go back to Minister Ford. Minister Ford.
Mr. Speaker, clearly what we need to do with coastal communities, as we are doing, we're working with Minister Ford in education to make sure that childcare is available for every child, which is why we're keeping early years in particular open, why BAYS is working to make sure that we protect jobs and create new job opportunities for those in coastal communities.
We know a substantive question to Minister Scully.
Yeah, the government has taken significant steps to support employment opportunities for women, and that includes starting with protecting jobs. The coronavirus job retention scheme has supported 4.5 million jobs done by women. The self-employed income support scheme has issued grants to 1.4 million women, and we're providing an extra £4.6 billion to support sectors required to close during the lockdown, which we know predominantly employ women.
Let's head to Newbury with Laura Farris. Laura Farris.
Thank you, Mr. Speaker. Female employment is highest in the services sector and has been hit particularly hard by redundancies in hospitality, retail and leisure. The new deal announced by the Prime Minister in June focused on house building, road building, infrastructure, all vital sectors, but heavily geared towards male employment. Can my honourable friend confirm whether there are equivalent plans to stimulate female employment in the months ahead? And would he meet with me to discuss this?
Minister.
I thank my honourable friend for that question and what she is doing to encourage such employment. We're committed to having a fair recovery for all. During the crisis, we rolled out unprecedented levels of support to protect jobs for both women and men. And of course, yes, I'll be happy to meet my honourable friend to discuss what more we can do to stimulate employment, including female employment, in the months ahead.
We now come to Shadow Minister Charlotte Littles.
Thank you, Mr. Speaker. Research by the Trades Union Congress shows that around 90% of mothers have taken on more childcare responsibilities since the pandemic began, with 43% having to balance childcare with working from home. This is a particular pressure for single-parent households, the majority of which research shows are headed by women. With women at greater risk of redundancy and disproportionately employed in sectors hardest hit by shutdowns, will the Minister commit to creating a legal, enforceable and immediate right for parents to request paid flexible furlough?
Minister. Certainly furlough is available for women that and indeed men who have childcare responsibilities. It is at the moment a responsibility of the employer to whether to give that. But if women do feel unduly disadvantaged of that, they can approach ACAS.
James Simpson.
Question 12, please, Mr. Speaker.
With permission, Mr. Speaker, I will answer questions 12 and 13 together. I want to make sure the equality agenda moves beyond just protected characteristics. Instead, we will make sure that we're focused on every individual in Britain having a fair chance in life and fair access to public services.
Jim Sundler.
Mr. Speaker, I really welcome the government's agenda on women and equalities, and I commend my right honourable friend for her outstanding leadership. But could I please also ask her to reassure me that we will never bow to those who suggest that white people should feel guilty for being white, or those who peddle the notion of white privilege. We're in this together, so will she please undertake today to write to other government departments to reinforce this?
Secretary Truss.
Britain is one of the best places in the world to live, no matter your skin colour, sexuality, religion or anything else. And we need to be positively empowering people in Britain to succeed so everyone has access to opportunity, not using positive discrimination. And that is the approach we are taking right across the government.
Let's head to Bob Blackman in Harrow East. Bob Blackman.
Thank you, Mr. Speaker, and a very happy Lowry for the Dogra community who are celebrating today. I agree completely with my right honourable friend on the need to ensure that we move beyond the Equality Act 2010, but first we need to reform it. Will she bring forward proposals to remove caste as a protected characteristic from the Equality Act 2010 so that we can ensure that the Hindu, Sikh, Jain and Muslim communities are not disadvantaged in our society?
Secretary Truss.
Well, I thank my honourable friend for his question. Caste is not a protected characteristic in the Equality Act 2010, and case law has already shown that a claim of caste discrimination could qualify for protection under the race provisions in the Act.
We now have a substantive question to Secretary Truss. Secretary Truss.
We can and must have an equality agenda that is driven by evidence, and that's where we've launched an equality data project, which will look at the life paths of individuals across this country and deliver hard data about the barriers people face.
Let's head to Gedling with Tom Randall. Tom Randall.
Thank you, Mr. Speaker. Over the Christmas break, I was disappointed to read in The Guardian comments by Halima Begum, the director of the Runnymede Trust, who ridiculously claimed, "I think the government's long-term plan is to work up white nationalism for the next elections." Would my right honourable friend agree with me that not only should this insulting thinking have no place in the setting of government policy, should have no place in mainstream discourse?
Secretary Truss.
Well, I agree with my honourable friend. These comments are appalling, and they reflect an attitude on the left of politics that says if you're not from an oppressed group, then you're not entitled to an opinion. And I think that is fundamentally wrong. I believe that equality is for everyone, and I'm not going to let this debate be dominated by a few campaign groups.
We now have to move to topicals. We start with Tom Hunt.
Topical question 1.
Secretary Truss.
Mr. Speaker, as we recover from COVID, we need to make sure everyone in Britain has a chance to succeed and is being treated fairly in the workplace. We're broadening the focus of the Equality Hub from protected characteristics to equality for all, and in particular tackling the scourge of geographical inequality. I will shortly be saying more about our new fight for fairness, delivering a better deal for everyone and standing up for fundamental human rights and freedoms across the world.
Tom Hunt.
Speaker. I very much welcome the fact that the equality agenda will be looking beyond simply protected characteristics. One key problem has been white pupils who are eligible for free school meals and how academically they have underperformed compared with other low-income groups. Does the Minister feel as though the fact that the equality agenda we've been working with, which has been almost exclusively focused on protected characteristics, may be an explainer in why this is the case?
Well, my honourable friend makes a good point. The attainment score for GCSE for white British children who receive free school meals is lower than the equivalent for black and Asian children. And at the Equality Hub, we're conducting a life path analysis to understand where the real issues are, and we're working closely with the Department of Education to take action on this issue.
We now go over to the Shadow Secretary of State, Marcia de Cordova. Marcia.
Thank you, Mr. Speaker. The impacts of 10 years of austerity are stark. 14 million people are now in poverty. And figures out today show that 45% of disabled people in work at the start of last year have reported no earnings by summer. And the figures from the Department for Work and Pensions show that there are more women likely to live in poverty. In 2010, the Tory-led government scrapped the Equality Act socio-economic duty. Addressing class and other inequalities is not an either-or. So in the Minister's newfound passion to address class and poverty, will she now enact the socio-economic duty?
Thank you, Mr. Speaker. We have made significant progress since 2010 in addressing disparities, for example, closing the attainment gap in education. But we recognise that during the COVID crisis, more needs to be done to address inequality and help level up our country. But the way we're going to do that is to focus on equality for everyone across our country, making sure everyone has a fair chance, including addressing the issue of geographical inequality, which is severe in this nation.
Our second question from the Shadow Secretary of State. What the hell have they done again?
Okay, that'll be Maria Miller.
Right, we'll come back to that. Maria Miller.
Mr. Speaker, the evidence shows that women face significantly greater risk of violence and harassment than men in many aspects of their lives. And to show their continued commitment to this issue, when will the government be ratifying the International Labour Organisation's new global convention outlawing violence and harassment at work? And will my right honourable friend join me in supporting UN Women's Safer Spaces Now campaign for better safety online and in public spaces too?
I thank my right honourable friend for that question. We are finalising consultations across government on ratification of the ILO Violence and Harassment Convention. Once complete, we will inform Parliament of our intentions regarding ratification. And I would also like to let her know that the government shares the Safe Spaces campaign's goals to see street harassment stamped out and is committed to tackling all forms of abuse against women and girls.
We now go back to the Shadow Secretary of State for the second question. Marcia O'Connor.
Thank you again, Mr. Speaker. So in the Minister's speech last month, she stated that she wanted to focus on facts, and she's made reference to that today. So focusing on facts, not fashion, and to concentrate on data and research. Yet the overwhelming body of evidence of structural racism is clear. It is a fact that Black Caribbean children are more likely to be excluded from school. It is a fact that Black women are 5 times more likely to die in childbirth. I say to the Minister, this is not fashion, they are facts. And doesn't this evidence point towards the need for action rather than the continual denial and dismissal of the realities of systemic racism?
My honourable friend, the Minister for Equalities, has already presented the clear evidence there is on the COVID crisis. My point is that rather than looking at equality through the prism of groups, we should be focusing on making sure that every individual in this country, regardless of their race, their background, their sexuality, or their sex, has the opportunity to succeed. And that is what the data project that we are working on will look at.
Heading to Shadow Minister Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. I've been contacted by a waspy woman who is a carer for her severely disabled ex-partner. She stopped work in 2019 due to his escalating care needs and was awarded carer's allowance. When she finally received her state pension, after decades of paying into the system, she was shocked to find she was no longer eligible for carer's allowance. How can it be right that when they hit pension age, carers, 72% of whom are women, are no longer eligible for support?
Apologies, Mr. Speaker. I will take up her point with the Department for Work and Pensions.
We now are coming to questions to the Prime Minister. Hi, Prime Minister. I will first call the Prime Minister to answer the engagements question 1, and then I will call Sir Kier Starmer to ask his supplementary. Prime Minister.
Mr. Speaker, I'm sure members of the House will want to join me in offering our condolences to the family and friends of our former colleague Brian Binley, who died over Christmas and who was an irrepressible member, Mr. Speaker, of this House. Mr. Speaker, today we are publishing our proposals for reforming the Mental Health Act. For too long we've seen rising rates of detention that not only had little beneficial effect, but left some worse off, not better off. That's why we're making sure the Act works better for some of the most vulnerable in our society and gives them more of a legal right in deciding what treatment works best for them. And my right honourable friend, the Health Secretary, will update the House shortly. Mr. Speaker, this morning I had meetings with ministerial colleagues and others, and in addition to my duties in this House, I shall have further such meetings later today.
We now head to South West Devon with Sir Kier Starmer. Sir Kier.
Thank you, Mr. Speaker. And I know the whole House will want to associate itself with the Prime Minister's remarks about our dear Brian Binley. Mr. Speaker, one of the groups hit hardest by the pandemic is young people in full-time education, especially those facing exams last year and this, with all of the mental health challenges that come from such uncertainty. Does my right honourable friend agree that those for whom exams have been scrapped this year would now benefit from the utmost clarity about how exactly they will be assessed? A clear plan announced early without last-minute changes to help teachers and students prepare for an even more challenging experience. Thank you.
Well, my right honourable friend is absolutely right, and there is clearly a problem of differential learning that has grown over the last few months and risks being exacerbated now by the current lockdown, and we'll do everything we can to ensure that exams are fair, that the ways of testing are set out in a timely way, and the Department for Education is launching a consultation with Ofqual to ensure that we get the right arrangements for this year.
We now come to the Leader of the Opposition, Right Honourable Keir Starmer.
Thank you, Mr. Speaker. Can I join the condolences expressed by the Prime Minister, I'm sure on behalf of the whole of the House. Can I also, Mr. Speaker, begin by paying tribute to all of those involved in the vaccine programme. I went to the Newham vaccine hub last week, and it was really uplifting to see the NHS, the Red Cross and lots of volunteers all working together and giving real hope. They had a simple message to me, which is if they had more vaccine, they could and they would do more. And I'm sure that's shared across the country. I welcome news that's come out this morning about a pilot of 24/7 vaccine centres. I anticipate there's going to be huge clamour for this. So can the Prime Minister tell us when will the 24/7 vaccine centres be open to the public, because I understand they're not at the moment, and when will they be rolled out across the country?
Well, I'm grateful to the Right Honourable Gentleman for what he says about the the rollout of vaccines. And I can tell him that we'll be going to 24/7 as soon as we can, and my rival friend, the Health Secretary, will be setting out more about that in due course. And as he rightly says, at the moment the limit is on supply. We have a huge network, 233 hospitals, 1,000 GP surgeries, 200 pharmacies and 50 mass vaccination centres, and they are going, as he has seen himself, exceptionally fast. I pay tribute to their work, and it's thanks to the work of the NHS and to the Vaccine Task Force that we have secured more doses, I think, per capita than virtually any other country in the world, certainly more than any other country in Europe.
Keir Starmer.
Thank you, Mr. Speaker. I obviously welcome that and urge the Prime Minister and the Government to get on with this. We're all happy to help, and there are many volunteers who are. The sooner we have 24/7 vaccine centres, the better for our NHS and the better for our economy. Mr. Speaker, the last PMQs was on the 16th of December. The Prime Minister told us then that we were seeing, in his words, a significant reduction in the virus. He told us then that there was no need for endless lockdowns and no need to change the rules about Christmas mixing. Since then, since that last PMQs, 17,000 people have died of COVID. 60,000 people have been admitted to hospital. And there's been over 1 million new cases. How did the Prime Minister get it so wrong? And why was he so slow to act?
Prime Minister.
Well, Mr. Speaker, of course, what he fails to point out is that on the 18th of December, 2 days later, the government was informed of the spread of the new variant and the fact that it spreads roughly 50 to 70% faster than the old variant, and that is why it is indeed correct to say that the situation today is very troubling indeed. We have 32,000 COVID patients in hospital. The NHS is under huge strain. And Mr. Speaker, I would like to take this opportunity to pay tribute to all the staff, the doctors, the nurses, everybody working now in our NHS who are doing an extraordinary job under the most challenging possible circumstances to help those who so desperately need it. And I thank them for what they are doing. But at the same time, I also want to thank all those involved in what is the biggest vaccination programme in the history of this country, where once again the NHS is in the lead, working with the army and the legion of volunteers and everybody else. And that programme of vaccines, Mr. Speaker, does show the way forward. It does show how we're going to come through this pandemic. And again, I repeat my gratitude to all those involved, because they've now vaccinated 2.4 million people, delivered 2.8 million doses, more than any other country in Europe. This is the toughest of times, Mr. Speaker, but we can see the way forward.
Mr. Speaker, the Prime Minister says that effectively 2 days after that PMQs, the advice changed. The truth is, the indicators were all in the wrong direction back at the last PMQs. But be that as it may, the Prime Minister says he got that advice on the 18th of December, 2 days after PMQs. And we've all seen the Sage minutes of the 22nd of December confirming the advice that was given to the government. The government's advisers warned the Prime Minister that the new variant was spreading fast and it was highly unlikely that November-style lockdowns would be sufficient to control it. Pretty clear advice on the 18th of December to the Prime Minister from Sage. Tougher lockdown than November is going to be needed. I've got the minutes here, everybody's seen them. Yet instead of acting on the 18th of December, the Prime Minister sat on his hands for over 2 weeks. We're now seeing in the daily figures the tragic consequences of that delay. So how does the Prime Minister justify delaying for 17 days after he got that advice on the 18th of December?
Well, Mr. Speaker, I must disagree very profoundly with what the right honourable gentleman just said, because he knows very well that within 24 hours of getting the advice on on the 18th about the spread of the new variant, we acted to put the vast part of the country into much, much tougher measures. And indeed, what we are now seeing, and it's very, very important to stress that these are early days, we are now seeing the beginnings of some signs that is starting to have an effect in many parts of the country, but by no means everywhere. And it is early days, Mr. Speaker, and people must keep their discipline, keep enforcing the rules, and work together, as I've said, to roll out that vaccine programme. But, Mr. Speaker, I do recall that on the day that we went into a national lockdown, and sadly we were obliged to shut the schools, even on that day, the Labour Party was advocating keeping schools open for understandable reasons, Mr. Speaker, because we all want to keep schools open, but I think it a bit much to be attacked for taking tougher measures to put this country into the protective measures it needed when the Labour Party were themselves calling then to keep schools open.
Mr. Speaker, just for the record, I wrote to the Prime Minister on the 22nd of December. I hadn't seen the sage advice at that stage, saying to him, if it indicated there should be a national lockdown, he should do it immediately and he'd have our full support. I'll put that in the public domain so people can just check the record. But, Mr. Speaker, more fundamentally, the Prime Minister says we took measures straight away, we put people into different tiers. The advice was a November-style lockdown is not enough. How on earth was putting people into a different tiered system an answer to the advice that was given? And isn't this the situation that every time there's a big decision to take, the Prime Minister gets there late? The next big decision is obvious. The current restrictions are not strong enough to control the virus. Stronger restrictions are needed. And it's no point members opposite shaking their heads. In a week or two, the Prime Minister is likely to be asking members to vote for this. So can the Prime Minister tell us, when infection rates are much higher than last March, when hospital admissions are much higher than last March, when death rates are much higher than last March, why on earth are restrictions weaker than last March?
Mr. Speaker, we keep things under constant review, and we will continue to do so. And certainly if there is any need to toughen up restrictions, which I don't rule out, Mr. Speaker, we will of course come to this House. But perhaps, as is so often the case, the right honourable gentleman didn't listen to my earlier answer, because I pointed out to the House that actually the lockdown measures that we had in place, combined with the Tier 4 measures that we were using, are starting to show signs of some effect, and we must take account of that too, Mr. Speaker, because nobody can doubt the serious damage that is done by lockdowns to people's mental health, to jobs, to livelihoods as well. And Mr. Speaker, if to listen to the right honourable gentleman over the last 12 months, you'd think he had absolutely no other policy except to plunge this country into 12 months of lockdown. And as for coming too late to things, Mr. Speaker, I think it was only a few weeks ago that he was attacking the vaccine task force that has secured the very doses, the millions of doses that have put this country into the comparatively favourable position that we now find ourselves.
It's just not true. Every time I've spoken about the vaccine, I've supported it. But the Prime Minister says we're balancing health restrictions and the economy. And yet we ended 2020 with the highest death toll in Europe and the deepest recession in any major economy. So that just isn't a good enough answer. Mr. Speaker, I want to turn to the latest free school meals scandal. We've all seen images on social media of disgraceful food parcels for children, costed at about £5 each. That's not what the government promised. It's nowhere near enough. So can I ask the Prime Minister, would he be happy with his kids living on that? And if not, why is he happy for other people's kids to do so?
Well, Mr. Speaker, I don't think anybody in this House is happy with the disgraceful images that we've seen of the food parcels that have been offered. They are appalling. They're an insult to the families that have received them. And I'm grateful, by the way, to Marcus Rashford, who highlighted the issue and is doing quite an effective job by comparison with the right honourable gentleman in holding the government to account for these issues. And the company in question has rightly apologised and agreed to reimburse. But it is because we want to see our kids properly fed throughout this very difficult pandemic that we've massively increased the value of what we're providing. Another £170 million in the COVID winter grant scheme, £220 million more for the holiday activities and food programme, and we're now rolling out the national free school meal voucher scheme, as we did in March, to give parents the choice to give kids the food that they need. Under this government, we will do everything we can to ensure that no child goes hungry as a result of the privations caused by this pandemic.
Keir Starmer.
Mr. Speaker, the Prime Minister says that the parcels are disgraceful, but it shouldn't have taken social media to shame the Prime Minister into action. Like the Education Secretary, he blames others, and he invites me to hold him to account. So let me do that. Because blaming others, Prime Minister, it's not as simple as that, is it? Because I've checked the government guidance on free school meals, the current guidance, published by the Department of Education. I've got it here. It sets out example parcel for one child for 5 days. Department of Education, Prime Minister, you want to be held to account. 1 loaf of bread, 2 baked potatoes, block of cheese, baked beans, 3 individual yoghurts. Sound familiar? That's the images, Prime Minister, you just called disgraceful. The only difference I can see in this list and what the Prime Minister has described as disgraceful is a tin of sweet corn, a packet of ham and a bottle of milk. So he blames others. But this is on his watch. The truth is, families come last under this government, whether it's exams, free school meals or childcare. Will the Prime Minister undertake, he wants to be held to account, to take down this guidance by the close of play today and ensure that all of our children can get a decent meal during the pandemic?
Speaker, the right honourable gentleman's words would be less hypocritical and absurd if it were not for the fact that I
don't believe anybody's a hypocrite in this chamber. I think we need to be a little bit careful about what we're saying to each other. There was a not truth earlier, and there was also comparisons to others. Please, let's keep the discipline in this chamber and the respect for each other. We're tidying up how this Parliament behaves, and I certainly expect the leadership of both parties to ensure that takes place. Prime Minister, would you like to withdraw hypocrisy?
I'm delighted to be advised by you, Mr. Speaker. Let me confine my criticism to the absurdity of which I hope is acceptable, Mr. Speaker, of the right honourable gentleman attacking us over free school meals when it was a Conservative government that instituted free school meals, universal free, not a Labour government, and of the 280 billion that we have spent securing the jobs and the livelihoods of people across this country, uprating universal credit, increasing and in addition increasing the living wage by record amounts this year and last year, increasing local housing allowance. The overwhelming majority, the bulk of the measures, the benefits fall in favour of the poorest and the neediest in society, which is what this House would expect. And Mr. Speaker, he takes one position one week, one position the next. That is what he does. That's been his whole lamentable approach throughout this, if I can get away with lamentable, Mr. Speaker, throughout this pandemic. And he says he supports the vaccine now. He says he supports the vaccine rollout, and he goes and tries to associate himself with it because he senses that it is going well. But don't be in no doubt, Mr. Speaker, that was the party that wanted us, this country, to stay in the European Union vaccine programme. He stood on a manifesto. He stood on a manifesto which he has not repudiated, Mr. Speaker, to dismantle the very pharmaceutical companies that have created this miracle of science, which is true.
Prime Minister, there are questions, and sometimes we've got to try and answer the question to what was asked of you. I think to run through the history is one thing, but in fairness, it is Prime Minister's questions. What I would say is it was the final question. We've got lots of others to go through. So I think what I'm going to do now is move on to Simon Jupp in Sidmouth, who's desperate to ask a question of you, Prime Minister. Simon Jupp.
Thank you, Mr. Speaker. The hospitality industry is the lifeblood of East Devon. Our pubs, restaurants, cafes and hotels provide thousands of jobs, places to meet and places to stay. The generous support package now put in place will tide many of these businesses over for now, but they will need further support. Will my right honourable friend consider extending the VAT cut for hospitality to give them a helping hand when they're back open for business?
Well, I'm grateful to my honourable friend, and I know that my right honourable friend, the Chancellor, has done everything he can to help businesses throughout this pandemic, and that's why he's extended the grants, and that's why we've got the cuts for both for VAT and for business rates, and we will do everything we can to help as we go forward. But the best thing would, of course, be to ensure that we roll out this vaccine programme and bounce back as fast as possible. Any further announcements my right honourable friend makes will be well ahead of the well ahead of the 31st of March, by which we intend to have a budget.
Let's head up to Scotland to the leader of the SNP with Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker. My constituent in Lochaber, a producer and exporter of shellfish, is experiencing his worst nightmare. After loading a lorry of fresh local seafood on Monday, as he's done for 35 years, his driver faced bureaucracy and delays. Brexit red tape now means that £40,000 of his fresh, high-quality produce is lost, unable to be sold. Mr. Speaker, that 40,000 produce is income for over 100 local families in many remote and fragile communities. Can the Prime Minister tell my constituent, where is the sea of opportunity that he and his Scottish Tories promised?
Prime Minister.
Well, Mr. Speaker, we're putting £100 million into supporting the fishing industry in Scotland and across the whole of the UK. And it is the policy of the Scottish Nationalist Party, not just to break up the United Kingdom under their harebrained scheme, but also to take Scotland back into the EU and hand back control of Scottish fisheries to Brussels, thereby throwing away all those opportunities in a way that I think the right honourable gentleman himself opposite would say was totally absurd. And I'm amazed that he continues on this track.
Returning to Ian Blackford. Ian Blackford.
I'm amazed that the Prime Minister continues to traduce the name of the Scottish National Party. He's been told before and he really should get it right. And frankly, that answer was an insult to all fishermen that are facing loss today. The reality is, Mr. Speaker, that a third of the Scottish fishing fleet is tied up in harbour. Some boats are landing in Denmark rather than Scotland to avoid Brexit bureaucracy. Scottish seafood exporters are losing upwards of £1 million in sales a day. Seafood Scotland says all the extra red tape is an almost impossible task. It's even forced ferry operators to pause load deliveries to the continent. Mr. Speaker, the European Union have put in place a £5 billion fund to support businesses with the cost of Brexit. Last night, it was revealed that Ireland is receiving £1 billion of it. Can the Prime Minister tell Scottish business when they will be getting the same level of support, and where's the compensation for my constituent that's losing £40,000 today?
Mr. Speaker, he continually advocates the breakup of the union with the United Kingdom, and he continually advocates going back into the European Union, even though that would be immensely destructive to the Scottish, immensely destructive to the Scottish economy, to jobs, to livelihoods, to pensions, to the currency. And as far as I understand it, they're already spending money in Scotland on IndyRef 2, what they call IndyRef 2, when they should be getting on, Scottish nationalists should be getting on with fighting the pandemic. That, I think, is what the people of Scotland want to see. And he might pay tribute, by the way, to the merits of the United Kingdom in rolling out a vaccine across the whole of the country. And I'm told, by the way, Mr. Speaker, that they can't even bring themselves to say the Oxford AstraZeneca vaccine. Perhaps he could just say that he likes the Oxford AstraZeneca vaccine.
Well, let us move to Yorkshire instead with Julian Sturdy. Julian Sturdy.
Thank you, Mr. Speaker. With the vaccination programme making very encouraging progress, can the Prime Minister reaffirm that lifting restrictions to return to normal as soon as it is safe is an overriding national priority? And can I invite him to consider drawing a line in the sand in terms of vaccination of sufficient numbers of the priority group, the reaching of which will trigger a phased relaxation of controls as immunity widens?
Minister.
Yes, Mr. Speaker, I can confirm that we're going to go down the top 4 priority groups who account for 88%, sadly, of COVID deaths. The target is, as he knows, by the 15th of February. There will then be an opportunity to look very carefully at the measures that we have in place, and we'll try to reverse the restrictions as soon as we reasonably can in a way that doesn't involve overwhelming the NHS.
Let's head to Northern Ireland with Sir Geoffrey Donaldson. Sir Geoffrey.
The Prime Minister promised us that Northern Ireland would continue to have unfettered access to the UK internal market. And yet in my constituency, consumers are facing empty supermarket shelves. They can't get parcels delivered from Great Britain. Small businesses can't bring spare parts and raw materials into Northern Ireland from Great Britain. Steel importers are facing tariffs, and we have many other problems, all caused by the Northern Ireland Protocol. So what I and the people of Northern Ireland need to know from the Prime Minister, as leader of the United Kingdom, is what his government is going to do to address this. If he will consider invoking Article 16 of the Northern Ireland Protocol to resolve these issues, because the Trader Support Service is welcome, but it isn't the solution alone. We need direct government intervention to deal with this now.
Well, I thank the right honourable gentleman. I can tell him that at the moment goods are flowing effectively and in normal volumes between Great Britain and Northern Ireland. So far, no lorries have been turned back. Yes, of course, there are teething problems, and what I can say, what I can confirm to him, is that if there are problems that we believe are disproportionate, then we will have no hesitation in invoking Article 16.
Let's head to Rushcliffe with Ruth Edwards. Ruth Edwards.
Thank you, Mr. Speaker. May I congratulate my right honourable friend on his trade deal with the EU and welcome the prospect of a more global approach to our trading policy. Would he agree with me that a free port based at East Midlands Airport, connected to the world by trains, planes and automobiles, and focused on generating green growth is key to the success of global Britain?
Well, I'm delighted that she's campaigning for a free port. I'm a passionate supporter of free ports. They will be a process, as she knows, and successful applicants will be announced in the spring.
Let's head up to St Albans with Daisy Cooper. Daisy Cooper.
Thank you, Mr. Speaker. I hope that the Prime Minister will join with me in congratulating the local GPs and all the admin, medical and volunteer staff who have set up the Batchford Hall Vaccination Centre in St Albans at incredible speed. They have already vaccinated thousands of residents, but their enormous local drive and success is being hampered because they are only being provided with enough vaccine supplies to vaccinate 1,100 people a day for just 2 days a week. And they are often only getting the vaccine deliveries at very short notice. So will the Prime Minister personally intervene to ensure that the Batchford Hall Vaccination Centre in St Albans and all PCN-led local vaccine services have a much greater and more consistent vaccine supply so they can get on with the job of vaccinating the country against COVID?
Well, I certainly thank the GP Vaccination Centre in St Albans for what they're doing and for their wonderful work, and it's thanks to, as I say, to primary care networks across the country that we've done 2.8 million vaccines, 2.4 million people, and the constraint is not the distribution network, it is the supply. But don't forget that we have a bigger supply than most other European, all other European countries. Indeed, we've virtually done as many vaccines as all other European countries put together, and we will be ramping up that supply in the days and weeks ahead.
Thank you, Mr. Speaker. Will the Prime Minister join me in thanking Shropshire's defence engineers, both in the public sector and the private sector, currently working on the Warrior and Boxer military vehicle programmes, doing a great job. But as the government considers making a decision on the Challenger 2 life extension programme, will you bear in mind that excellent workforce in Shropshire that have had such a history and a modern day practice of delivering UK defence?
Of course, Mr. Speaker, I'm familiar with the superb workforce in Shropshire to which he refers, and of course there is a competition currently going on, negotiations going on with the modernisation that he speaks of. As he knows, we've made the biggest investment in our defences since the Cold War, with the recent spending review, but it would not be right for me to comment on these negotiations at this stage.
Let's head to Hornsey Wood Green with Catherine West. Catherine West.
Thank you, Mr. Speaker. Prime Minister, widening inequalities are tearing communities apart, and COVID's made things much, much worse. In Hornsey and Wood Green, we have a 182% increase in joblessness. Today, will the Prime Minister pledge to reverse the planned £1,000 per annum cut to universal credit to provide a certain future to all of those increasing numbers of people who use universal credit as a lifeline?
Well, Mr. Speaker, not only have we upgraded universal credit by £1,000, but as I've said, extended. Increase the local housing allowance, increase the living wage, many other benefits. We will keep all of this under constant review. But I may say that I know that she speaks for the Labour front bench. The current Labour policy, as far as I understand it, is to abolish universal credit. And I think many people in receipt of universal credit, knowing how important it is, will find that stunning in view of what she's just said.
To Brigham Gould with Andrew Percy. Andrew Percy.
Thank you, Mr. Speaker. Here in East Yorkshire and North Lincolnshire in the Humber, we have some of the highest flood risk in the country, and we're still waiting for the report into the flooding on the River Aire at East Carrick and Snaith, just up the road from me here, which took part 10 months ago. I welcome the doubling of flood defence funding. It is most welcome in an area particularly such as mine, but we often come up against the challenges of bureaucracy and sometimes the Treasury funding rules. So can I ask the Prime Minister to look at what more can be done to reduce the red tape in bringing schemes forward, and what we can do to, whilst I appreciate the need for national agencies, also utilise local flood councils or drainage boards by providing them with direct cash, as well as to the Environment Agency, to bring forward projects that will protect homes and people.
Prime Minister.
Yes. Well, my honourable friend makes a really excellent point about the need to improve flood defences, and that's why we're investing £2.6 billion in 1,000 flood defences in England in the next few years, in the next 6 years. And the Humber Estuary, the area that he represents so well, is one of 4 areas which will benefit from trials into long-term ways of making all our country more resistant to flooding.
Let's head to Kevin Brennan in Cardiff. Kevin Brennan.
Thank you, Mr. Speaker. There's real disappointment that a reciprocal work permit-free deal for touring musicians and performers has not been agreed with the EU. No one's interested in a blame game. It's clearly fixable and in Britain's economic and cultural interest to do so quickly, but it needs leadership from the top. So will the Prime Minister meet on this virtually with a small group of MPs, including the Conservative chair of the Culture Select Committee? We're all singing from the same song sheet. Will he please say yes to the meeting?
I will, of course, ensure that there is a proper meeting with the honourable gentleman and his colleagues on this subject, which is extremely important. And I know that our friends in the EU will be wanting to go further to improve things for both, not just for musicians, but for business travellers of all kinds, because there is a mutual benefit.
Mr. Speaker, for the first time in my lifetime, we are now a fully sovereign and independent nation. So I'd like to thank the Prime Minister on behalf of the people of Redcar and Cleveland for getting Brexit done. As the member for Rushcliffe pointed out, one of the key benefits of Brexit is our ability to create 10 new free ports. And in Teesside, we have the largest brownfield development site in Europe, the deepest port on the East Coast, a fantastic Tees Valley Met in Ben Houchin, and a plan to create 15,000 jobs over the next 20 years. So does he agree with me that the best place for our first post-Brexit free port is Teesside?
There's been a bit of a theme to these interventions from my brilliant Freeport campaigners behind me. They're absolutely right. We don't hear about it from the party opposite. But Mr. Hydrogen, as I think my honourable friend is now known, makes an excellent point. As I said earlier on, the bidding process is underway, and it would be wrong of me to comment any further.
Let's head up to Kingston upon Hull with Cal Turner. Cal Turner.
Thank you, Mr. Speaker. I want to join my right honourable and learned friend, the Leader of the Opposition, in paying tribute to those involved in the vaccine rollout. But, Mr. Speaker, the Yorkshire Post highlighted this week that many of the country's 11,000 community pharmacies stand ready, willing and able to deliver desperately needed COVID vaccines. Yet his government have seemingly shunned an army of fully trained, experienced and registered technicians. Pharmacies like Witham Pharmacy in East Hull are at the forefront of the flu vaccine every single winter and are ready to play their part in the national effort. So will the Prime Minister now take control and fully mobilise the skills and expertise of community pharmacies to get Britain vaccinated?
Well, Mr. Speaker, there are 9,000 fantastic community pharmacies across our country. They do an amazing job. What we want to ensure is that we get doses to the places where they're going to be distributed most effectively, the fastest, and I'm sure the Honourable Gentleman wouldn't want to see doses distributed to places, many places where they might not all be used in the course of the day. We need at this stage to avoid any wastage at all, and that's why we're concentrating, as I say, Mr. Speaker, on the 233 hospitals, 50 mass vaccination sites, 200 pharmacies already, Mr. Speaker, and we will ramp that up, and it will be particularly important as we come into the phases when we need to reach people who are harder to reach in local communities, and their local pharmacies will, as he rightly says, play a vital role.
Let's head up to Norfolk with Duncan Baker. Duncan Baker.
Thank you, Mr. Speaker. I'm sure the Prime Minister will join me in saying that we owe an enormous debt of gratitude to all our carers, including unpaid carers and young carers, and those throughout the social care profession for the tireless work they have done during the pandemic. And representing the oldest constituency demographic of North Norfolk, I firsthand have seen their work. Yet these professionals often feel forgotten about. This needs to change. Will the Prime Minister commit to a 10-year plan for social care to match the one for the NHS as the foundation to start reforming social care in this country?
My honourable friend is absolutely right to highlight the extraordinary work that's done by carers, social care workers up and down the country. They have got us through this pandemic. We must continue to look after them in any way that we can, and we must commit, as we have done, to reforming the sector, giving people the certainty that they need, and we will be bringing forward proposals later this year.
Let's head up to Scotland with Gavin Newlands. Gavin Newlands.
Thank you very much, Mr. Speaker. On Monday, thousands of British gas workers finished striking in protest at the threat of being fired and rehired on reduced terms and conditions. Of course, it was British Airways' shameful fire and rehire actions which prompted the Prime Minister to say he was looking at what he could do. He's also called for employers to display fairness and respect, but clearly that hasn't and isn't happening, and he must now step up. I have a bill with cross-party support which would outlaw the practice. So will he meet with me to discuss how we can provide more protection for all our workers?
Well, thank you, Mr. Speaker. And we, as he says, we believe that using threats of firing and rehiring is unacceptable as a negotiating tactic, and there are laws in place to ensure that contractual conditions can't discriminate against people on grounds of race or sex or disability. But I'll take up his point by saying that the Department for Business is working with ACAS, businesses and employee representatives to discuss what more we can do.
Thank you, Mr. Speaker. Jay Fathers died in hospital having been stabbed in the early hours of New Year's Day. Last week, the killers of Dom Ansar and Ben Gillam Rice were sentenced to life imprisonment. Knife crime is destroying lives in Milton Keynes, across the Thames Valley, across the UK, even during the pandemic. Can my right honourable friend outline what support the government is giving to provide police forces with the tools they need to make our streets safer?
Thank you, Mr. Speaker. Well, first of all, we're introducing knife crime prevention orders that are placing curbs on and limits to deter young people from going equipped and getting involved in knife crime. We've made sure that we deliver on the serious violence strategy, engaging with young people, steering them away from knife crime. But what it takes is continuous and serious law enforcement, making sure that people who carry a knife do get the sentences they deserve. And that's why we're also putting more police out on the streets of our country and have recruited almost 6,000 of the additional 20,000 that we committed to at the last election.
Let's head to Cardiff with Anna McMorran. Anna McMorran.
Thank you, Mr. Speaker. Workers in Cardiff North and across the country are facing continued job insecurity. And as we've heard, shameless fire and rehire tactics, forcing British gas workers to take a stand against this and strike in the most difficult of circumstances. But the director of British Gas responded by boasting that COVID has kept this strike out of the news. Will the Prime Minister condemn these remarks and protect the livelihoods of thousands of workers and their families by finally outlawing fire and rehire?
Well, Mr. Speaker, insofar as that was the gentleman's intention, he's failed in that. And I think possibly the best thing I can do is repeat what I've just said to the Honourable Gentleman who's already raised this strike. We regard fire and rehire as unacceptable, and we will continue to make that point and seek further means of redress.
Let's head to Andrea Leadsom in Northamptonshire. Andrea Leadsom.
Thank you. I'm grateful to my right honourable friend for the opportunity to chair an early years healthy development review on behalf of the government. He knows only too well how awful the lockdown has been on new parents and their families, in addition to the existing pressures that new parents find themselves in. So can he assure me that the recommendations of this important review will form a core part of his ambition to build back better and make sure that every baby gets the best start in life?
Mr. Speaker, it's many years now since I've been listening to my right honourable friend make these points with the passion and the knowledge that she does. I know that she's right. I look forward very much to her review and to her submitting her findings and to working together with her to achieve the change that we want for early years children.
Final question, Andy Slaughter.
Thank you, Mr. Speaker. This week I got an email from Eleanor Huff, the Deputy Head of Wendell Park Primary School in my constituency. She says lack of government guidance means her staff will soon be teaching over 100 children in school, 10 times the number in the first lockdown. Now, having a lockdown in name only may suit the Prime Minister. He can feign tackling the virus while tipping the wink to his anti-lockdown backbenchers and bending the rules himself. But as Miss Huff says, her pupils and staff, who like all Hammersmith schools are doing a fantastic job under the most difficult of circumstances, deserve better. Why are they being hung out to dry by the Prime Minister and his Education Secretary?
Prime
Mr.
Minister.
Speaker, I want to thank very much all the schools in Hammersmith, indeed throughout London and throughout the whole country, who are working so hard to look after vulnerable kids, to look after the children of key workers, and at the moment the percentage in school is about 14%, which is, as you will appreciate, higher than it was back in March. And I think the gist of his question was that schools should be closed. I must altogether. I don't think that is right. I think what the country wants to see is the children of key workers and vulnerable kids getting the education that they need. And I thank very, very much the teachers, all the staff involved for making that possible.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order.